The press conference was about the presentation of the Assure results, long awaited, huge adjuvant trial of adjuvant zoledronic acid added to standard adjuvant treatment, and nicely complementing the patient selection we had studied previously in the ABCSG12 trial. The results were kind of surprising and in fact thought-provoking, I would call them. Overall, it's a negative trial. There's not too much difference in terms of the primary endpoint, which is disease-free survival. But it's very interesting to see that in that large trial, they see in a significant subgroup of patients, which is those women with breast cancer who are clearly after menopause, more than 5 years after menopause, they see a significant disease-free survival benefit, but also a significant overall survival benefit, 30%, which is huge. They were not able to demonstrate such a benefit in a premenopausal setting, which obviously raises the question, what's the difference between the ABCSG12 premenopausal patients and the Assure premenopausal patients? And the clear-cut difference is that ovarian function suppression was not used in Assure. So obviously, and that's the thought-provoking thing in terms of the science behind it, obviously you need double action to quiet the bone marrow microenvironment bone markers, but also estrogen suppression, which is really very, very interesting. Well, it's going to be a difficult situation in terms of the clinical application because on one hand, at first sight, we have a negative trial, which is usually not very good for approval of drugs and regulatory and business perspectives. On the other hand, we now have at least 2 subgroups of breast cancer patients, postmenopausal patients and premenopausal patients on ovarian function suppression. And together, they comprise 3 out of 4 patients in the whole breast cancer population. So I'm pretty sure that many physicians around the world will consider adjuvant treatment with zoledronic acid in these situations in the future. The updated ABCSG12 results show another scientifically interesting aspect, and that is the persistence of the benefit long after the completion of therapy. To remind you, in ABCSG12, it's 3 years of intervention and then all treatments stop and patients go without any further treatment. Now we have results beyond 5 years and some patients even out to beyond 10 years. And we see a complete persistence, clear persistence of that reduction in disease relapses and improvement in overall survival. And this is not what we usually see in oncology or in medicine. Usually we have to treat, and when we stop treatment, the benefit goes away. Obviously, when we target the bone marrow microenvironment, and I find that exciting as well as reassuring to patients, it might be good enough to do an early time-limited intervention, and patients will still derive long-term benefit and maybe even increase the cure rate, which is just great.